An ectopic pregnancy can be defined simply as a pregnancy outside of the uterus. Removing one is not considered an abortion in Texas. Ectopic pregnancies can be deadly, but some doctors are hesitant to remove them. Dr. Lisa Hansard with the Texas Fertility Center says that's illogical.
I've heard that physicians are saying, we'll keep you in the hospital, we'll monitor your blood count, we'll wait until it looks like you're in imminent danger before we treat. To me, that has no logic.
Anti-abortion advocates say the laws are clear. An act is not an abortion if the intent is to save the unborn child, remove an unborn child if the mother had a miscarriage, or remove an ectopic pregnancy. Kylene Wright, the president of Texans for Life, says doctors who fear penalties for removing an ectopic pregnancy might not know the law.
I think some of the questions that people are raising, it really comes from sort of an agenda and a bias on their part, but it is very clear in law. It's not ambiguous at all. I don't think it's going to be a threat to them.
Dr. Hansard agrees, saying doctors should not hesitate to help their patients with this.
This should not be changing the way that we practice medicine. An ectopic pregnancy is never, ever viable.
Dr. Hansard says she's not fearful of doing her job, but frustrated.
Physicians are challenged, for most of us, the first time in our career, with the government coming into the examination room and having access potentially to medical records, to having to justify medical decisions that we're making with our patients. And so there's a fear that this will be potentially misinterpreted by someone that doesn't have any kind of a medical background but has some degree of legal standing.
In Austin, Charlotte Scott, Capital Tonight.